Basically, what I did on your case is I tried to do everything I can to irritate the spine. Most of the stuff that I did with you is neurologic, believe it or not.
Okay.
Because when I lift the leg up, when I do the slump test, when I do all those other movements, what I'm really trying to do is pull down on the nerve and irritate it. And congratulations, it wasn't super severe because usually at the 20, 30, or 35 degree mark, which is about like, well, if you laid on your back, it would be like here. It gets really bad, which is probably what you experience when you're in really bad shape.
Yeah, exactly.
Which tells me it's very, what's the word? I don't want to call it intermittent. I guess you could just say it's intermittent.
Yeah, no.
In that case.
Yeah.
The pain is intermittent, but what I'm doing is I'm trying to pull down the nerve. I tried to pull down at this angle to affect the common peroneal nerve, the tibial nerve, and the sural nerve, and all these other nerves that you don't necessarily need to know about right now because it didn't go past your leg, and I tried to make it go past your leg, and I couldn't. Yeah. So congratulations, it's here up.
Okay.
Right?
Yeah.
So what every time I did is when we did that slump test, what we're really doing is we're pulling down at that nerve, but you're in the seated position, and then I have you bend forward with bad posture, which rounds the spine, which is again what that other chiro was saying, and then I have you pull up this direction, and so really I'm pulling up here and I'm pulling down there, and I'm creating a lot of neural tension in the middle. So what that looks like on the spine, let's get rid of here, what it can look like, and I'll show you a different model as well, is that when you can get compression, you can get a little bit of that bulging that occurs as this nucleus moves backwards, right?
Okay.
So if that nucleus moves backwards, it'll look like this.
Got it. Yeah.
So this thing will fill in that gap right there, or maybe a little bit bigger. It doesn't have to be perfect.
Yeah.
But now the nerve comes out of here, and so when you move and bend forward, you actually are wedging that thing further, almost like stepping on that jelly donut, and now that nerve gets irritated occasionally. You have a couple bad days of poor posture, a couple days where you lift with your back, a couple bad days where you do this, and then before you know it, you have this aggravated symptom. And so what we did really is we just had you do a bunch of the extension work, and we actually helped migrate that disc backwards, back into that, decompressing that, and so that's going to be your actually pain relief homework there.
Got it.
Where you will get a very, very good benefit therapeutically, and it's actually a great thing for you to do like preventatively. It's a great thing that you don't have to do it forever, but like in the immediate short term, I'm going to give you that stuff.
Okay. Perfect. Yeah.
So I think in that case you're